Postpartum birth control options. It is essential to discuss postpartum birth control options with women before the end of their pregnancy, as not all women wait 6 weeks to resume sexual intercourse postpartum. As discussed in class, optimal pregnancy spacing is approximately 2 years, and women can potentially ovulate before their 6-week postpartum office visit. In the first weeks postpartum, if clients do resume intercourse, it is crucial to emphasize the importance of a non-hormonal barrier method of contraception, like condoms, something like that. Hormonal methods should be avoided for at least 3 weeks in order to allow clotting risk factors to return to their normal pre-pregnancy state, as well as establish maximum breast milk supply prior to initiation of any hormonal contraceptives. For non-breastfeeding women, CDC guidelines state that combined estrogen-progesterone contraceptives can be resumed at 21 days postpartum in women with no additional risk factors for deep vein thrombosis. However, women with additional risk factors or women who delivered via cesarean should not begin combined contraceptives until 42 days postpartum. For breastfeeding women, CDC guidelines state that progesterone-only contraceptives are the best choice, since estrogen-containing contraceptives can have a negative effect on milk supply. Progesterone-only pills, Micronor, also known as the mini pill, and Depo-Provera, the progesterone-only shot, are appropriate options for breastfeeding women, as they will not impact the breast milk supply the way estrogen-containing contraceptives will. For both breastfeeding and non-breastfeeding women, both the hormonal and non-hormonal IUDs are also appropriate methods of contraception. Both are options that can be inserted as soon as the immediate 10 minutes postpartum, as well as any time between birth and the 6-week office visit at a very small risk. While counseling breastfeeding women, however, it is important to note that progesterone has the potential to slightly decrease breast milk supply, so the non-hormonal IUD may be more appropriate. There is also a slight increase in the risk of IUD expulsion if one is placed before 28 days postpartum. The CDC categorizes postpartum contraceptives on a 1 to 4 scale, which takes into account varying risk-benefit ratios and the risk of postpartum DVT. I have added that chart from the CDC to the discussion post so that you guys can take a look at it and see the varying risk levels of all of the postpartum options for contraceptives.